name's Ed Mitchell, and this is mainly a book review of this book that I read a couple, 2-3 years ago, or a few years ago. It's the autobiography of the French doctor who invented the spinal instrumentation that literally revolutionized the surgical treatment of scoliosis back in the 1980s. And it's kind of fitting to do this video this year. This summer will be the 25-year anniversary of my surgery. So just to sum up my case real quick, I was diagnosed with adolescent idiopathic scoliosis when I was 13 in 1983 with sort of a right thoracic curve, sort of borderline 30 degrees, like borderline mild to moderate. Through my teenage years, it kind of gradually progressed to right around 45, 46 degrees or so, which is kind of right at the point where you think of doing the surgery. So 1989, the summer that I turned 19, was the summer I had my surgery. And so at that time, in 1989, there weren't that many hospitals in the United States that were doing this technique yet. It was invented in France. The first operations were 1983, 1984 in France. First operation in the United States was 1985. So in 1989, at the time I lived in Ann Arbor, Michigan, and as I was looking at, as myself, my parents were looking into doing the surgery, what we did basically was, 1989, there's no internet, and we went to the medical library and we got all the information we could on scoliosis surgery, and it became clear there were it was a period of transition, basically. There were two techniques. There was the Harrington instrumentation, which had been the gold standard through the 1960s and 1970s, and then there was the newer superior technique invented in France, which I'll get to the meat of the story in a moment. Basically, you get three-dimensional correction of the abnormality, and with the Harrington instrumentation, you didn't, and I'll go into explaining that in just a bit. So we learned that, and clearly we wanted this technique done. And we ended up finding a surgeon in Minneapolis through connections my dad had, because he knew a pathologist who had connections in the medical world. So we got to what was then the Minnesota Spine Center. Now it's the Twin Cities Spine Center in Minneapolis, Minnesota, which is probably the #1 spine center in the United States. And I had a surgeon who was from France, had worked with the guy who invented it, and I had a fantastic surgery, and walked out of the hospital 6 days after the operation. No brace, no cast, just moderate restrictions, and after a few months of moderate restrictions, basically I could do whatever I wanted, and the abnormality was almost completely corrected. The only little bit of a part of it I still have, the rib prominence. Before surgery it was like 1.5 centimeters, and it was reduced down to, I think, less than a centimeter, and I could have had that fixed even further by having the rib sawn or something, but my surgeon said don't even bother, because it's going to be so minor. So, and that's the only little bit part of the abnormality that I still have visible on my back. And I've run 12 marathons in the last decade. I run 50 to 70 miles a week. have almost never had any problems with my back. Very minor problems down at L5-S1, but it may not even relate to the operation. It's because my 20-year anniversary, I sent x-rays out to my surgeon in Minneapolis. He wrote me a letter back, and that may be completely independent from the scoliosis, actually. And that's just really a minor problem that I have. So anyways, this story here, it was really something to read this story all the years later after I had the operation. So I had the operation in 1989, and in the years after the operation, I pretty much forgot about it, and life just went on. But after the internet came out, and periodically I would just see what was going on, Google the scoliosis world. And some years ago I came across this book that Dr. Cotrel had written, his autobiography. And so I bought the book and I read it, and I found it a really amazing story. So I thought I'd summarize the book at this point. So anyways, Dr. Yves Cotrel was born in 1925 in France, and he started medical school at the end of World War II. And when he finished medical school in 1948, originally his plan was to become an obstetrician. But just after he finished medical school, by chance, there was this opening at an orthopedic institute in the town of Berck. It's on the coast of France. And he was asked if he would fill in this position that was there, and that it would only be 1 month. And he went to, he accepted, thinking he was going to go there for 1 month, and he ended up staying there for 30 years. And he ended up marrying a woman who was a sister of one of the patients at this orthopedic institute. So in 1948, he goes to this orthopedic institute in Berck, and in the these are pictures from that, and I can show you, here's geographically